So ultimately, I was exonerated on all charges and actually received an apology in writing, not a public one. And we were able to get them to retract the media statements they'd made about me, which is, again, this is all political. It had nothing to do about patient care. It had nothing to do about biochemistry. It had nothing to do about science. And that's the tragedy that we've all been growing up in, evolved in the information we're receiving. It's actually not science. It's politics. It's money. It's ideology. It's fascinating how much we've been screwed over. And when you start realizing that this is a slow, insidious torture of your body, and the processed food that we've had, well, arguably since the agricultural revolution. So you can trace our inflammatory joint disease, we can trace back modern disease back to the agricultural revolution. You can go to pre-agricultural revolution skeletons, and in Spain, they will identify, oh, that's pre-agricultural revolution, that's post-agricultural revolution, literally in the changes in their bone. 10,000 years we've been processing carbohydrates into our diet, milling grains, storing grains. But in the last 40 or 50 years, we have exponentially increased our inflammatory component to disease. Ultra-processed foods now have been giving us low-grade inflammation right through the body. So in the person with diabetes, we can talk a bit about fructose metabolism, glucose metabolism, inflammatory seed oils in that process, but he has had a slow, chronic inflammation in every blood vessel, in every cell, in every mitochondrial membrane for as long as he's been eating processed food. And the culmination of that over time is that you end up with microvascular disease, narrowing of every blood vessel. You've got chronic inflammation in the tissues, a fibrosis in the tissues. So they have poor circulation, poor local immunity, and all you need is a little tiny scratch or break in the skin, dry skin, some bacteria get in there, fungal infections get in there, and then the body doesn't have the ability to fight that. And so over a long, long period of time, a war between the local infection and the body's immune system trying to control it. The only way to get rid of that isn't with dressings and antibiotics. It's to chop the bit of dead tissue off, because no good circulation is going to get in. So you've got to get back to an area where there's reasonable circulation. They recognised that amongst all of my colleagues, I got to clean all that up. So therefore, all the horrible deep infections, it's not just diabetic foot problems. I did most of the, probably most of the deep joint infections. So someone has a hip replacement or a knee replacement. Same problem in our society now, poor immunity, deep infections in joint replacements, months in hospital. Same problem. If you've got a person who's chronically inflamed and they've got diabetes, they're in deep strife. They're not going to fight that. Do we keep chopping limbs off? To the end of my surgical career in the public system was every week there'd be 20 to 30 patients in that clinic with gangrenous toes, gangrenous feet, and you'd be doing this slow but sure. Chop a bit of the toe off, chop another toe off, then chop off the forefoot, then the midfoot, then the ankle, and then the below knee amputation. And if you end up with a below knee amputation, mortality, your 2-year mortality is around 50%. So 50% of people die within 2 years of having leg amputation.